Hi, I'm Dr. Joe Alaimo. I want to take time to just welcome you and thank you for taking time out of your day to listen to this video or watch this video on hypothyroid, thyroid conditions, and Hashimoto's disease. Now, I'm a board certified chiropractor. I'm not a medical doctor, and I don't prescribe medicine, and I don't take people off of medicine. That's not our goal. Our overall goal is to improve patients' physiology and decrease their symptoms, so maybe they can reduce the need for some of their medication. But that's between you and your doctor. That has nothing to do with us. Now, I've been practicing functional medicine now for the past several years, and in particular, have a special focus and passion for helping patients with thyroid problems. That's hypothyroid and Hashimoto's disease in particular. Now, I consider myself an authority on this topic because I've studied with Dr. who is the nation's probably top researcher and clinician when it comes to dealing with thyroid problems. He's the author of this book, Why Do I Still Have Thyroid Symptoms When All My Labs Are Normal? And a lot of patients ask these questions. That's why he wrote the book. This is the #1 best-selling book on Amazon.com when it comes to thyroid conditions, and recently it's become the #1 best-selling book in health overall. Lots of people suffering with thyroid problems, about 24 million, 27 million, and it affects women 24 to 1 more than men. So we have a pretty large problem here. And again, I'm passionate about helping patients regain their life and get out of the slumps that they're in due to ineffective management, really. Now, a lot of people say, well, you're just a chiropractor. What do you know about thyroid or diabetes? Well, again, besides being trained by Dr. and following his protocols, I've also studied with Mark Hyman, who's a medical doctor, and you've seen him on Dr. Oz and a lot of other shows. He's a functional medicine doctor that practices a lot of the same way that we do. In addition to that, I've kind of lived through this lifestyle. And what I mean by that is that I was a patient at one time too. I was a regular chiropractor, just doing backs and necks like most chiropractors. And not that there's anything wrong with that, but that's all I was doing. I wasn't trained in the nutritional aspect of the physiology of what we're doing now. So my wife was diagnosed as PCOS, which is the #1 cause of infertility in the country. Now PCOS is polycystic ovary, and again, #1 cause of infertility. It mimics hypothyroidism, meaning a lot of the same symptoms overlap, like hair loss, inability to lose weight, depression, brain fog, constipation, hair in unwanted places, gut problems, GERD. A lot of these symptoms overlap. In fact, 43% of all patients with PCOS also have hypothyroid. So the conditions are very interlapped. And it's just important to understand this because very often patients get misdiagnosed or mismanaged based on that one assumption alone. So what we did was the traditional healthcare approach towards trying to have a baby because she had infertility. So we followed the traditional healthcare model in terms of the proper drugs, the proper surgeries, the proper procedures in an attempt to try to get pregnant. And guess what? It didn't work. So we were a little bit disgruntled in that model, but we still believed in it, and we knew that, we really didn't have many options. We had to do what they said. So next step was going to be in vitro fertilization, IVF. And we did that with one of the best clinics in the country. Spent a lot of money, over $20,000. And guess what? Still didn't have a baby. So I made it my mission to find out the underlying cause of why this happens and how we can help patients that are suffering with this. Because if you're trying to get pregnant or if you've been through that, you know what I'm talking about. It's very devastating to the family, to the wife, to the husband as well. So I knew that there had to be a reason that her body couldn't do this, and I was aiming and geared towards finding out why that was. And we did find a solution. After researching this, found out that it comes down to a blood sugar problem, hyper or hypoglycemia, too high or too low, insulin resistance, and elevated testosterone in a woman. Now again, that's the #1 cause of hair falling out in a woman, is elevated testosterone, and that needs to be checked in a lab. And also insulin resistance. So you need to break this cycle of insulin resistance and elevated testosterone before you break this PCOS cycle. And we were able to do this with my wife, and within a year she got pregnant. And I know this works, so I believe in this. And again, I was a patient just like now I'm teaching patients this, but I was a patient at one point, and I learned this. And now we're pregnant again, so we've done it more than once. So it's really exciting to know that we can change people's lives like this. Now, I want to explain to you a little bit about the traditional healthcare model towards handling hypothyroid and compare that to the alternative model, and then compare it to the functional medicine model, which is what we do. Traditional healthcare model is based on looking at your TSH levels. That's thyroid stimulating hormone. As it rises, doctors will put you on some type of prescription medication to bring that TSH down. Something synthetic, like levothyroxine or Synthroid, or something natural like Natrethroid or Westhroid or Armor. And these medicines are all geared towards bringing your TSH levels down. And very often they're effective in doing that. The problem is patients still have symptoms. So now they're still complaining of inability to lose weight, depression, constipation, hair loss. The doctor says your labs are all normal because they balanced out that TSH. Patient still feels terrible, so what do? They put you on more medicine for depression, for gut problems. They send you to a dermatologist for your hair problems. And they tell you that your thyroid's normal, it's not your thyroid. So that's your traditional healthcare model. That model's been around since 1960. And frankly hasn't changed much since then. Now the next model we look at is alternative healthcare. Alternative healthcare isn't much better. A lot of alternative healthcare providers look at tyrosine, iodine, and glandulars in an attempt to try to balance out the thyroid naturally. And unfortunately, this has been a failing model as well. So the functional medicine model has worked out really well in our office and in hundreds of offices across the country. We work with over 400 other doctors around the country in helping patients achieve optimal health and wellness through the functional medicine process. And what we do is we look at the whole body, the whole person. We look at extensive labs and we figure out the underlying physiological dysfunction and how we can improve that physiology so we can decrease patient symptoms. And that's why we believe that in our office clinically, we've had tremendous success. You can go to our website, www.drjoealaimo, that's Dr, no period, joealaimo.com, and listen to all the different testimonials we get from patients that have traveled from many states to come see us in an attempt to try to get better and have had the best years of their lives when they get under treatment with us. And it's really just enlightening and just exciting to see people's lives change. Now, we have to understand that when you have a thyroid problem, which is what most people come to see us with, it's really not just a thyroid problem. We look at it as a web of physiological dysfunction. What that means is that most of my patients come to me with gut problems. So they may have gas, bloating, diarrhea, constipation, GERD, heartburn, reflux. They may have problems eating greasy foods or emptying their bowels, a lot of different digestive type problems. They also come to us and they have problems with gallbladder, which is very common with hypothyroid cases. Now, also the main thing, or one of the main things, is blood sugar imbalances. Myself and Dr. Karazi both will admit that we've never treated a hypothyroid patient that did not have a blood sugar abnormality going on. Now that can be too high or too low, and that needs to be fixed. If that is not addressed and corrected to the best that we can, either through diet, nutrition, or lifestyle, patient just doesn't get better. So we understand that as a big priority in terms of trying to get patients better. And again, most patients have these dysfunctions. The next category is adrenal glands. Adrenal glands produce your cortisol or your stress hormone. And when the body's under continued stress, the adrenal glands are overworked. Now the adrenal glands, if they're overworked, will cause problems like brain fog, belly fat, depression, female hormone problems, and gut problems. So again, it's real important to have cortisol looked at because that's your stress hormone. 3 different types of stresses: physical, chemical, and emotional. Physical is if the dog's chasing you. That's a normal response. Stress should be for 2 to 3 minutes. That's the way God designed our bodies, was to deal with short-term stressors. Emotional stress is death of a loved one, loss of a job, finances. Those are all emotional stresses, which can be helped with exercise, prayer, meditation, breathing exercises, music. A lot of these different things will help the emotional stress. Chemical stresses are anything we take into the body. That can be things like tobacco, nicotine, alcohol, gluten, dairy, a whole host of other things that we take into the body, and the body has a stress response to that. When the body has a stress response, it releases cortisol. And again, when cortisol stays out of balance for a long period of time, it will lead to adrenal fatigue. And these are patients typically that have no energy to get up out of bed in the morning, even after 8 to 10 hours sleep. They just feel poop. Or at nighttime, they can't go to sleep. They're laying in bed with their eyes wide awake, lots of thoughts running through their head, and they can't shut it off. That could be elevated cortisol at the end of the night. So we look at cortisol on a couple different levels. I don't know how regular doctors, traditional healthcare providers, and even alternative healthcare providers do not look at cortisol as an integral part of helping a patient overall. Because we're all under a lot of stress. We need to figure out what the stressors are, try to alleviate those, and try to balance out cortisol. I think that's critical to the management of these types of conditions. We also look at hormones. A lot of times patients with thyroid problems will have issues with progesterone or estrogen. They're either on birth control pills, they may have been on estrogen replacement therapy or progesterone replacement therapy, and these imbalances will throw off the overall physiology of the body. You have to understand one thing, that when you have hormonal imbalances in the body, they are always secondary to something else. You don't just wake up and have a problem with a hormone, unless it's related to cancer or some type of tumor or something like that. So you can have it, but overall, we don't try to fix somebody's hormones until we fix the other physiological imbalances, because those are the things that cause the secondary problems. Now, how are we different? Because again, I'm sitting here saying that we do things differently and we get really good results with what we do, but I want to explain to you a little bit about how we're different. The main way that we're different is the traditional healthcare model will look at labs, and the basic labs that they run, we run as well. We just run more of them. I equate that to being a detective. And if I ask more questions, I'm going to get more answers. So they'll run basic labs, and if you're within the clinical range, which is what the lab says is normal, then you're normal. And that's a very broad range. The way that they come up with these broad ranges is everybody that goes to a lab in a given year, they'll take out the highest numbers, they'll take out the lowest numbers. Everybody in the middle is considered normal. That's a bell curve. We look at things from a functional perspective, meaning that the functional numbers are what we know that the body needs to function at the highest level possible. An example is TSH. Now, a clinical lab value for TSH, and you can look in your labs to see what it is usually this is what the lab says is normal, 0.45 to maybe 4.5. And again, that's a really broad range. They get that number by everybody that goes to get their thyroid tested. And people that go to get their thyroid tested are usually sick and usually on medication. So that number is skewed to begin with. Now, the Endocrine Society, which is the largest research organization in the world, says that thyroid needs to be the TSH should be 1.8 to 3.0 to have optimal functioning thyroid. So again, we look at things from a functional perspective. So we have functional ranges for all your lab markers, not just clinical markers, because clinical markers are looking for disease, we're looking for abnormal function. So that's kind of the main way that we look at labs differently, and you may come to us and have a subclinical anemia. Go back to your medical doctor and he may say, you don't have anemia. Just understand the way that we look at things is just a little bit differently. Now, the main thing we need to go over really is, why are you not getting better? Bottom line is, if you have pain and you take pain medication, you should feel better. You should have decreased pain. So if you have a thyroid problem and you take thyroid medication, your thyroid symptoms should improve. The reason that most patients don't improve is because 80 to 90% of all hypothyroid patients are Hashimotos. Most of you have never heard of the word Hashimotos. Hashimotos is when the body attacks the thyroid. So it's an autoimmune attack against the thyroid. Some other autoimmune diseases include rheumatoid arthritis, celiac disease, Sjogren's disease, lupus, dermatitis herpetiformis, other conditions that are related back to where the body is attacking itself. Even type 1 diabetes is an autoimmune disease. So if you have an autoimmune disease, typically patients are going to present differently than if it's a regular hypothyroid case. Now, my Hashimoto's patients typically have hyper and hypothyroid symptoms. That's a big clue that it's a Hashimoto's case and not a regular thyroid case. Secondly, their TSH goes up and down for no explained reason, with or without medication. Next is they are unresponsive to medication. So they constantly are searching for the right doctor with the right medication to fix their thyroid problem. They don't ever seem to find that. Because again, if your problem is with your immune system attacking your thyroid, your problem is not so much with the thyroid. Your battle is not with the thyroid, your battle is with the immune system. Now, we have to address this in this manner because there are different ways that we also look at to identify Hashimoto's response. One way is through looking at TPO antibodies. This is a relatively inexpensive test, yet most of my patients never get this test done. And the reason being is that the traditional healthcare model, although they recognize the test, it does not change the treatment model. So they're not going to run other tests if it's not going to change treatment. And I agree with that. If it's not going to change your treatment, you don't need to do the test. Unfortunately, with us, it does change treatment, because now we realize it to be an autoimmune case, and we manage it differently as a result of that. Now, if you go to your doctor and you say that you want this test done, they'll run it. It's a relatively inexpensive test. If you have insurance, insurance covers it. If you don't have insurance, maybe $10 or $15 test. But even if it's diagnosed as positive, it's not going to change your treatment. It's still going to be some type of medication to manage your TSH. And that's it. And if you still have symptoms, we're going to give you drugs for those things as well. So that's kind of where I believe that the ball drops. We need to understand that in order to have an autoimmune disease, we need to have three things present. One is you need to have the genes. So most likely that you probably have either a mother, a grandmother, an aunt, a